Welcome to our webinar, Health and Wellbeing at Texas Tech. We are excited to have all of you joining us today. My name is Christine Self with Parent and Family Relations, and joining me today are Amanda Garcia from Student Health Services and Gregory Johnston from the Student Counseling Center. This webinar is part of our Red Raider Family webinar series, where we share information on topics of interest to parents, families, and supporters of our students. We hope this webinar will help you better understand some of the health and well-being support resources available to your students. As you can see on the screen, we have a couple of upcoming webinars on other topics like campus safety, academic success resources, and living on campus planned for this summer. So we hope you'll join us for those as well. We plan to keep this webinar to about 30 minutes or so. If there's time at the end, we'll open it up for questions using the Zoom Q&A feature. In the meantime, feel free to type your questions throughout the presentation. We also have some folks working behind the scene to get those answered for you. We are recording this session and posting it to our website so that you'll be able to review it again later or share it with others. We'll also email the recording link to the email that you used when you registered for the webinar. So let's go ahead and get started, and I will turn it over to Amanda.
Good afternoon, I'm Amanda Garcia. I work at Student Health Services as the Assistant Director of Patient Service Specialist. We are a part of Texas Tech Physicians here in Lubbock. We are on the Texas Tech University campus, so we are conveniently located on campus, and we care for the Red Raider student body. Our mission is to provide high quality care to our Texas Tech students as they realize their full potential. We are conveniently staffed with board certified and licensed physicians, nurse practitioners, physician's assistants, clinical psychologists, and licensed professional counselors. We provide a variety of services such as women's health, mental health, behavioral health. We have face-to-face visits, telemedicine visits. We see patients for primary care, same-day urgent care. So sore throat, any kind of care that they may need, services they may have received back at home, we can take care of those services here. Preventative care for women and men. Sports medicine, we have clinicians that are specialized in musculatory injuries. And so they travel with our athletic teams, but they also see patients here. So they can take really great care of them. We have travel medicine and nurse clinics. So we provide flu vaccines throughout the year, COVID vaccines, any kind of vaccines they may need. We provide behavioral health services, such as therapy, counselors. We have psychiatrists. We have a software platform, and then we also provide services in clinic. Assessment and referrals for higher education, for high risk for substances, lab services, basic radiology, and pharmacy, which all these services are at a discounted rate. We protect all the confidentiality of our students. Most of our students are 18 and older. However, if they are not, we do have to get our permission from their legal guardians. And so we will coordinate that care and make sure we have consents. So be sure that if your student calls and they're not feeling well, for them to keep you aware if they're a minor, because we will be reaching out to get that consent. Otherwise, we always protect the confidentiality. We fall under HIPAA here in our clinic, not under FERPA. So we protect their health information, their PHI. Cost of services. So we see patients who are insured and uninsured. If they are insured, we accept all major insurances, commercial, Medicare, Medicaid. We waive their copays because the students pay a medical service fee that we share with the counseling center. And so they're required to make it's a $95 payment through their student business services account. And that will cover them having access to student health in the counseling center. So because of that fee that they pay, it's only optional to opt out of paying for that fee when they are a graduate student. But anytime they're an undergraduate, it's already placed on their tuition. So you definitely want to reap the benefits. Copays, we waive the copays and deductibles. And then any services that are not covered. So we attempt to bill insurance. Whatever insurance doesn't pay is then discounted and billed to the student business services. So we're going to be the most affordable in the community. And if they have the academic healthcare plan, which is an insurance plan through Aetna that they can purchase. So any parents out there looking to add their student to an insurance plan, the AHP plan is amazing. And if they utilize that insurance plan in our facility, everything's covered at 100%. So it is students do not have to have any any finances at the time that they're scheduling their appointment or at the time of their visit, because everything's billed in the student business services account. So money should never be a barrier for them to seek health care. If they are self-pay without insurance, we give them a 60 to 70% discount. Again, we don't collect anything up front. Everything's billed to their student business services account. So typical urgent care visit could be anywhere between $30 to $50. So the cost is very low, especially compared to the community. So definitely make sure that they utilize us to lower their expenses for healthcare. We talked about my AHP care. You can visit this website and it'll give you information about the costs of the plan for domestic and international students. We set all of our students up with a platform called My Team Care. They are able to access their medical records. They are able to communicate with their healthcare provider, request appointments, review their lab results, all through our My Team Care app. We make sure that any new student seen in our clinic has access to this, so that way when they graduate, they have all of their information in the palm of their hands. Quick tips. Be sure to add our contact information to your student's cell phone number or cell phone, so that they have our number on hand when they are not feeling well. Understand insurance coverage and have information available. Make sure your student has a copy front and back of their insurance card. If they have a PPO plan, that's great. If they have an HMO plan, be sure that they change their PCP. If you do not want to change your PCP, we can always request an authorization for your office to allow up to a certain amount of visits to be seen here. But if you want everything to be covered at the highest percentage, please be sure that you just make sure that they have all the information they need, so we're able to get those authorizations going. Plan ahead, have them call early. Don't wait till they're, feeling awful. Once they are not feeling well, go ahead and tell them to give us a call early. We get booked up probably mid-morning to noon with patients contacting our office. So they definitely want to call ahead, not call at 3 or 4 o'clock. That's not the best time to get a same-day appointment, which is pretty typical in the community. Fulfill their commitments. We do require a no-show fee. And so if they do not make their visit, they will be charged a $25 fee to their student business services account. So in the event that they no longer need their appointment, they'll need to give us an hour in advance, call our office to cancel their appointment. That way we can just make sure that we reach all of our students who need to be seen, and that we have a really good rate of making sure our students are getting taken care of and seen in a timely manner. If you have any questions, you can add them to the chat, or you can wait till the end of our session. Thank you so much for your time. If you have any other questions, you can always view our website. Our website has so much information that I'd be happy for you to take a glance at. And I'm going to turn it over to Greg Watson, who is our Student Counseling Center. Thank you.
Great. Thank you, Amanda. Let me quickly introduce myself. My name is Greg Johnson. I'm a counselor here at the Student Counseling Center. To give you a quick understanding or idea of what the Counseling Center does here at Texas Tech, our charge is to meet the mental health needs for students on campus. We are located at the Student Wellness Center. We're actually on the floor above Student Health Services, so your maybe physical health needs are met on the first floor, and mental health needs are on the second floor, and we're in room 201 of that building. Our operating hours, we operate when the university is open, we're open. So we're open from 8 to 5, Monday through Friday. Again, we're open during summer hours and between breaks. If it's a holiday, then we're off at the same time that the university is off. For all enrolled students, and similar to what Amanda brought up, if a student is taking a course and paying a student use fee, then they're eligible for our services. So there's no additional charge for their mental health counseling. They are paying for that fee, but there's no additional charge for that. We do not accept insurance and we do not charge any copays. Like student health services, we do have a $25 no-show fee. So if a student has an appointment that's scheduled with their therapist and that they miss that appointment, they will be charged a $25 fee. And that's just to help us maximize our resources. Each therapist will determine the length of sessions with the client and maybe the most appropriate treatment modality. How students access our services. So we have what we call walk-in clinics, and students are eligible to come in. Walk-in clinics are from Monday through Friday, 12:30 to 3:30 in the afternoon. Each student will come in, fill out some intake paperwork, and be assigned to a counselor that day. The session lasts about 15 or 20 minutes. It's a way to gather and generate some information, get the student on a wait list if we do have a wait list, and get the process started. The time allotment for this is basically an hour and a half. So from time when they step in until they leave. So it is important to consider that and make sure that they have enough time in the afternoon to be able to meet that expectation. This will get the ball started and assign a student eventually with a therapist and start the counseling process. If a student is in crisis, we encourage them to come in at any time. So they can come in 8 through 5. They don't have to come in during those walk-in clinic times. We'll have a therapist available to work with that student if they feel like they're in crisis. So let's talk about some of the services that we have. So after you've completed the walk-in clinic, you and the therapist or the student and the therapist will decide what treatment modality is best. Some of the options that we have here are life skills and prevention groups. We have Manager Mood, which meets once a week. That's a group that I lead myself. It is basic kind of foundational skills for students. So we're looking at relationships, we're looking at emotional regulation. We are just kind of helping them learn that sometimes small changes in certain areas can have big results. And so it's looking at the relationships and the way we think about those. Uh, we also have what's called our Mind Spa. It is essentially a room designated in our office that has a massage chair. It has videos for students to be able to watch meditative practices or mindfulness practices. Essentially, it's something of an oasis on campus for students. They don't have to be a client of the Student Counseling Center to use that, but it's oftentimes something that they can use in conjunction with therapy, just if they have a break during the day and want to spend some time in the Mind Spa, just to kind of calm some of those anxious nerves, maybe, or prepare for the day. We have therapy assistance online. It's called TAO. It's our program that has self-guided modules essentially that work on things that students typically might struggle with. So some of the things that we see most often coming through the Student Counseling Center, these are modules related to healthy relationships, time management, anxiety prevention across the board that students can watch and participate in on their time. So maybe their schedule doesn't match what is available for the Student Counseling Center. Maybe they work during the day or have classes throughout the day. They have access to these resources nights and weekends, which could be really helpful. Bibliotherapy is basically reading books and doing activities through books that they can get through the Student Counseling Center. We have group therapy, which is student-led groups where you might have 8 to 12 students in a group, related to a specific topic, and they're able to offer support, but also maybe some strategies that have worked for them. And it's a very powerful therapeutic approach. Most students are interested in individual therapy, and this is where they are sitting in a room with another therapist and talking about challenges that are going on in their life, creating a treatment plan, and working towards healthier outcomes. We also have relationship therapy. We have all of us are generalists here in terms of our counselors. So we can see couples as long as both students are Tex Tech students. If We also have a relationship enhancement center, which meets in the spring and in the evenings. And for this, only one student needs to be a text tech student. The other partner can be someone, even if they're not a tech student, that's eligible to come in and talk about relationship concerns. We also work in consultation with faculty, staff, parents, and other in the mental health issues, more of a collaborative care, and offer outreach opportunities for students on campus. Confidentiality is something that we take very seriously and wanted to communicate that to parents and students. Um, all student counseling center contacts with students are confidential. That's in accordance to not only state law, but also HIPAA laws and also just developing trust within that therapeutic alliance. So everything that's talked about in the counseling space stays in the counseling space. Student employees cannot disclose if a student is receiving student counseling services. Can't talk with instructors without students' consent. So everything that is discussed in the counseling center is not shared outside of that space, which helps to improve the treatment, but also allow the student the freedom to be able to talk about things that are concerning. You're welcome to share information regarding a student with the Student Counseling Center staff. However, we can't really acknowledge and we must abide by these guidelines. So we welcome input and are happy to work with students in that regard. Manage your mood. Okay, this is our 4-week course. So it starts at the beginning of the semester and runs throughout the semester. And after each 4 weeks, we just kind of start over. It's been very popular for students. They've enjoyed that. It's a little bit less intimidating group experience. And if it's a low risk or a low distress area, maybe just transition to Texas Tech and feeling a little bit homesick or dealing with the ending of a relationship, this is an excellent opportunity for students. Again, we meet on Wednesdays at 2 o'clock. My email address is there, but you can also contact the Student Counseling Center and we can get you connected and set up for that group experience. We have Manager Mood online. So if you wanted to watch videos of me and a colleague talking about Manager Mood, you can access those if you're a Texas Tech student. We do that so that students can watch these videos of our presentations at their availability. So sometimes maybe they don't have Wednesday at 2 o'clock available. They can always watch these online. You can follow the link on the screen or go through the Student Counseling Center website. There's links that will take you to those videos. They're riveting, I assure you. The Mind Spa, again, is just a kind of oasis. It's kind of a Zen feel for students. They can come in and relax. They can listen to soothing music. They can get on the massage chair and just kind of take a little break from a stressful day. We actually added a VR component to that as well for relaxation. There's one VR component with meditation underwater. I'm not sure if that's relaxing or not, but it is available for students. We also have yoga mats and meditation videos and relaxing music, just again to kind of help them deal with some of the stressors that students experience during the academic semester, and it's definitely something to encourage a student to check out. Therapy online. So we have a couple of different approaches. So we talked a little bit about the TAO, which is module-based, student-driven. The next that we have is a program called TELUS, and TELUS is a company that offers student support counseling services. So it's something that students can access. It's 24 hours a day, 7 days a week. There's multiple languages. Students can do video chats, audio, telephone, or even texting, which I think is interesting. And this has really been popular for students that, again, maybe they work or go to class during the day, and so the 8 to 5 doesn't quite meet their needs. And so the TELUS is an approach that they can use to speak with a counselor, direct student counseling services just outside of the Student Counseling Center. And the last is Together All, which is a student-led support group. for students on campus, there is a moderator uh, that helps the students kind of stay on task and offer good information. But it's student driven and it's a helpful support group for students. Bibliotherapy, like we had discussed, uh, books on anxiety, depression, body image, coping skills, self-compassion, self-love. Just again, maybe some activities that they can do, journals that they can do through these books that might help them kind of understand why some of the thoughts and feelings are resulting in some of the behaviors, especially if those behaviors are not getting them the results that they want. This is an option again for students that might not feel most comfortable or not feel comfortable in that one-on-one or group experience. Kind of the bread and butter of what we do is individual therapy, and that's what most students are interested in. So we offer one-on-one therapy to address individual concerns. We offer virtual and in-person services so long as the student is in the state of Texas, has a secure internet access, and is able to have a private space. Um, Areas of focus that we talk about, just most mental health concerns, primarily anxiety and depression and relationship challenges are what we see the most often. There's also academic stress and challenges with some coping skills that might include substance use or other areas that can be problematic for students if they're trying to focus on academics. Our number one goal, truthfully, is to help your student be as successful in the classroom as well as outside of the classroom. And some of these individual therapy may be something that your student might be uh, able to access that would be helpful for them. In terms of groups, we do offer groups here. We have mindfulness groups, groups for special populations. Uh, these are groups led by students, so the content is generated by the students, and we have facilitators there to help navigate that. But it's a way to kind of understand that, hey, some of the things that I'm struggling with are things that other people struggle with. That might be kind of nice to have that understanding and also get some of the strategies that have worked for others that may be helpful for them. Relationship therapy. If your student is struggling in a relationship, we do offer that. It's nice to have a person that can kind of help the two students kind of navigate those relationship challenges. And this is an important part of our counseling experiences because relationships are major impacts on how we function in our day-to-day life. Our location is the second floor of the Student Wellness Center. That's the corner of Flint and Main. We're in room 201. Students can come in and talk with our front desk staff and get them situated in where they need to go. Our phone number is on the screen as well as our website. I encourage you to contact the center. Feel free to contact me here at the center if you have any questions outside of what we might talk about in the Q&A. I'm happy to be a resource for you all and to help your student be as successful as they can here at Texas Tech.
All right, I would like to thank both of our presenters for sharing this really important information. We always hear from families that they want to know more about health and well-being and what resources are available for students. So this was really great. So I want to thank both of you. Um, please put your questions in the Q&A. I've already seen some coming in. And while we're waiting on those questions, one thing that I did want to ask, and this is for you, Gregory, can you tell us, we get a lot of phone calls in our office about families who are maybe concerned about their student. And obviously a parent or family member cannot make an appointment for a student, right? But can you tell us maybe some things that families might want to watch out for when they're talking with their students? Maybe, there's obviously going to be students can get homesick, sure, but what are some things that they might be watching for and how can they best refer them to come see you all?
Sure, sure. Um, a, a referral to your student, just encouraging them to come to the Student Counseling Center is what we see the most often. We also have an approach that's through the Dean of Students office, and it's called a Student of Concern report. So this can be your student or any other student here at Texas Tech. So if your child speaks about a roommate or someone else that they're concerned about, you can access that. It's anonymous. The dean of students will follow up with the student, do kind of a wellness check, and if they need to encourage them to come to the student counseling center, that's a resource as well. So if you are noticing that things just don't feel quite right for your student, it is a stressful semester, and so sometimes anxiety and things like depression can be a big impact on the students. Just any changes in behavior that you feel might be kind of inconsistent with what you've known about your child growing up or the student growing up might be an indicator of that. If things start to feel overwhelming and you're noticing, gaps in when they're attending classes or they haven't been to class in a week or two, those are definitely warning signs. Just paying attention to that, listening to what your student is saying, encouraging them to be open and honest with you. Earlier that we can start working with this student, the better. Help changing some behaviors and getting some different outcomes. So if you just notice that, I would encourage your student to come talk to us. I'm happy to speak with your student if counseling is not something that they're interested in. I understand that. We have other resources on campus. But if it's something that's impacting their personal and academic life, it's definitely something that we can address here at the Student Counseling Center.
Thank you. All right, so in the Q&A, someone has asked, and this is for Amanda, is there a resource for students who are on medication for anxiety and ADHD on campus so they can be seen for their regular checkup appointments while living on campus?
So right now we recommend them to get their prescriptions transferred. Now right now we're not doing any testing. What they can do is they can reach out to our office and we will send a message to our case manager, and our case manager will follow up and let them know exactly what they'll have to evaluate it, and then we can take it from there. Good
Thank
question.
you. And then another thing that I've seen in the Q&A, and so other people might have the same question, how does a student go about, how do they figure out what to put for their primary care provider if they need to change it over?
Yeah, that's a good question. So when they contact our office and we know they have an HMO plan, we actually send them a signature with information of who their PCP needs to be changed to. It's also on our website. If they go to charges and billing and insurance, let's see. There's an upload center where they can upload their insurance. So if they don't happen to have an extra card to give to their student, they can upload their insurance card front and back there. And then we'll reply to them with that information of who they need to change their PCP to. We also have business cards that we give out at RO and hold removal that will have that information on the back of those cards as well.
Wonderful. Well, we are right at about 12:30. So if you still have questions, please continue to put those in the chat. On your screen right now, you can see our contact information. You are welcome to reach out to any of our offices with questions about the information shared today, or if you have different questions. And then we would love for you to take our really quick survey just to let us know how we did on the webinar today. But like I said, you are welcome to keep typing in your questions. We will stay behind the scenes just for a little bit to get those answered for you. And once again, I just want to thank everyone for being here today. Thank you for joining our webinar. Please sign up for future ones. We will follow up later today with the recording link so that you can review this information, share it with your student, share it with a friend, or just, refresh your memory about what you saw today. So thanks once again, and we'll stay on for just a little bit to keep answering your questions. Thank you.